and welcome to Women Over 40 Losing Weight. I'm your host, Dr. Kisha Pickford, a nurse practitioner and a hormone informed metabolic and weight loss strategist. And I'm also the founder of Ample Health and Wellness. And today, I just want to make sure that I say this is our 40th episode here at Women Over 40 Losing Weight. And I almost can't believe we're at 40 episodes already. And I want to thank everyone who's been listening and growing with me along the way. And I want to go ahead and jump right into today's episode because I want to talk specifically to the women using medical weight loss medications. Because sometimes when these medicines are working really well, we celebrate something that may not always deserve celebrating. We, and I'm saying myself included, we celebrate the fact that we are barely eating anything in whatever day it may be. And yes, decreased appetite can be one of the effects of these medicines, but here's the question I want us to start asking ourselves. Did I eat less or did I actually nourish my body well? And those are not always the same thing. That's a very different question. And as usual, on this 40th kind of celebratory episode, I'm with my co host, Jay. Jay, I know you heard from the beginning and you heard that topic. What do you think about today and our topic?
First off, congratulations on 40 episodes. That's huge.
Yeah.
Yeah. And honestly, I think today's topic is so needed because from the outside, it's easy to think smaller appetite, problem solved. But you're raising the deeper question. And that feels really grounding.
Yes, it does. It is a deeper look at things. Because a lot of times we can definitely be on the surface and just really not look at that whole picture. Because a lot of things matter when we're on this weight loss journey. And energy is one of them. The energy that we take in, it matters a whole lot. But eating less does not automatically mean that we're eating better. And I can speak, as I said, I can speak to this from my own experience because I'm still on my weight loss journey as well. And I take the medicine routinely and weekly, like the majority of the people who have tuned in or are tuning in with us. And I'm still working very hard to get that goal that I want, but there are days when my appetite, it just simply isn't very strong. And on those days, it's easy for me to look up and at the end of the day and realize, hey, wait a minute. Did I even eat anything today? Or did I eat very much? But I also want to make sure that I'm trying to be as intentional as I can, but I may not have gotten the protein that I needed, and I may not have gotten the fiber for that day that I needed, and I may not have even drank enough water for the day. So, yes, the quantity was low, but was the nutritional quality where I wanted it to be? And that's a different question and the topic that I want to make sure we address today.
I really like that, Keisha, because you're not saying eat more just to eat more. You're saying, let's make what you do eat count. And that just feels more kind, more doable.
Yes, that is what I'm trying to say and tell everyone. Because we talked last week about the prescription itself and how it can be a very powerful tool. But there are things that the prescription just cannot do for us. And we have to be very intentional to make sure that we're doing these things. So today, yes, I wanted to focus on the areas that I think women and also our prescribers should be telling a lot of us that when we're using these medicines, we need to pay attention to these areas.
Totally. And if you're comfortable, where do you usually start when you're walking through this with someone?
Well, the first thing that I usually tell um, my clients, myself, is that protein matters. The first thing on the list should be protein because as we get older, protecting our muscle becomes increasingly important. And when we're losing weight, we do not want all of the weight loss to come from lean tissue or from muscle. And that means that protein deserves our attention and it deserves to be number one on our food and drink list. Now, I'm not going to give everyone listening one universal protein number because individual needs differ based on health status, body size, how active we are, your function of your kidney, the health goals that you may have, and many, many other factors. And that's something I think that everyone listening can make an individual decision and plan with their healthcare or nutritional provider or professional. But here's the practical question I want everybody to keep in their head and keep in mind. Am I being intentional about the source of protein I'm eating? Am I getting the eggs, Greek yogurt, fish, chicken, beans, cottage cheese? Whatever your dietary preference may be, are you putting that in? Are you adding it? And when your appetite is low, you may not have room for everything, but I want to make sure that you're including that one. Because sometimes we have to become more intentional about what goes on the plate first.
So it's not just about eating less, it's also about not filling up on things that don't really fuel you.
Yes, it's not about filling up on something that doesn't give your body what it needs. We want to make those smaller meals count the most that we can make it count.
That makes so much sense. And it feels gentle too.
Yes, sometimes we make weight loss so hard, but I'm a practical person, a simple person. We just need to keep it simple.
Absolutely. So if protein is that first area, what's next on your list?
Well, the second thing I like to tell clients is don't forget fiber and hydration.
Hmm. That's so true. You probably see that come up a lot, right? Especially when appetite is low.
Yes, I see this come up quite often. And because we don't often think that those two go together. I know a lot of us don't always put those two together. And I like to because one needs the other. Because they both can make issues arise if we're just simply eating less and not eating enough of both. Because when food intake drops significantly, fiber and hydration, they both tend to drop as well. And one usually drops more than the other, but they go together. And with the weight loss medicines, they already affect how our gastrointestinal system works. And if we're not putting those two together, well, the digestive system, it can start sending you some unfriendly messages.
Yeah, that's real. And those signals matter. Even if the scale is moving, your body's still giving you feedback.
Yes, the body is smart. It was made smart. And so if you are not putting in the correct combinations, you can definitely get unfriendly messages all the time. And we're not going to go into great detail because I try to keep this a family show. But seriously, fruits, vegetables, beans, whole grains, and other fiber containing foods can still definitely matter. And the water matters because you need those two to work together. Because when your appetite decreases, even our normal cues to drink, it may get overlooked. And so we don't want to wait until the end of the day and say, suddenly, oops, I forgot to drink my water. when you've eaten all this fiber. So just make sure you're putting the two together so that you won't get an upset gastric system.
Right. So again, it's not about perfection. It's about noticing small things and responding with care instead of judgment.
Yes, we're trying to decrease judgment as much as we can because weight loss, obesity, being overweight is already judged enough. Because when it comes to your personal health journey, let's not judge. Let's just be intentional.
Yeah, I love that. Okay, so we've talked about protein, fiber, and hydration. Is there a third area that often gets overlooked?
Yes, there is a third one. And the third one may be the most important mindset piece. Don't turn eating as little as possible into the goal. This is not a competition to see who can survive on the least amount of food. The goal is not starvation. The goal is improving our health while losing weight appropriately. And I think this is especially important for women who spent years dieting, being the yo yo dieter. We can easily fall back into the old thinking less must always be better. But less isn't automatically better in this situation. Appropriate is better, intentional is better, nourished is better, being sustainable is better.
That's such a relief to hear. It takes it out of that all or nothing place.
Correct. That all or nothing, because I was one of those persons. The all or nothing. If I didn't do it correct the right way the first time, it was just over, game over.
So, what would a kind check in sound like in real life? Like a question you might ask yourself on a regular Tuesday.
You know, at your next meal, I want you to just pause and just ask 3 questions. It's easy. Where's my protein? Where's my fiber? Have I had enough water today? And that's it. 3 simple questions. Don't overhaul your entire diet. Don't create 17 new rules to start today. Just start paying more attention and start asking those 3 questions. Because if your medication is helping you eat less, let's also work on helping your body get more nutritional value from what you are eating.
That feels doable. Not dramatic, just steady.
Correct, steady. That's good. Just be steady. And, I want to make sure that we give a clinical reminder before we head home or we try to wrap things up. If your appetite is so suppressed that you're struggling to eat or drink adequately, you're having persistent vomiting, or if you're having significant gastrointestinal symptoms, dizziness, dehydration, or you're concerned about how you're tolerating the medication, please be sure to talk with your healthcare professional before you start managing your own treatment. Make sure you and your healthcare professional are working together. Don't simply assume that feeling miserable means the medicine is doing what it's supposed to be doing. Treatment
Right.
needs to be both effective and medically appropriate for you.
That's such an important reminder. And I hear the heart of what you're saying, supporting the whole woman, not just the weight loss. And honestly, Keisha, you're right there walking alongside, not waiting at some finish line.
That's correct. I'm always walking alongside my listeners, my clients, even my patients at the hospital. I can relate to quite a few of them. So I'm always walking alongside, and I'm not just waiting there saying, "Hey, I got it going on. I'm finished. Let me show you what to do." That we all have something that we're working on. So I always want to be walking there and relating to my patients, to my clients, to my people.
That's it. No finish line speeches, just real conversations, one day at a time.
Correct, correct. So, today's closing message, I want to make sure that I say eating less isn't always the same thing as eating better. If medical weight loss treatment is helping to reduce our appetite, I want us to use the opportunity to become more intentional about how we nourish our bodies. And that means protein, that means fiber, hydration, and enough nourishment to support that whole woman. Like you said, Jay, the whole woman has to be counted and not just weight loss.
Hmm, that's a beautiful closing, Dr. Keisha. Clear, compassionate, and grounded. And with that, we'll wrap today's conversation. Thank you all for spending this time with us. Until next time, take good care of yourself, one intentional choice at a time.
Yes, thank you all for spending so much time with us here at Women Over 40 Losing Weight and for listening to today's episode. And I also want to add if you know another woman using medical weight loss treatment and who could benefit from this conversation as well, please share the episode with her. And until next time, please give yourself grace, take care of your health, and keep moving forward. And remember, Keisha is not waiting for you at that finish line. I'm always walking this journey right alongside with you. And we'll see you in the next episode. Bye for now.
Before we go, if today's conversation encouraged you, don't let it stop here. Be sure to subscribe to Women Over 40 Losing Weight so you don't miss an episode. And if you know another woman who could benefit from this message, share this episode with her. You can also learn more about Dr. Keisha's resources, including her root cause weight loss and wellness audit, her book, The Wait is Over, and the ample weekly newsletter in today's show notes. Thanks for spending time with us. We'll see you next week.